where'd you go? I missed you so.
Seems like it's been forever since you've been gone. I can't carry a tune in a bucket. That was terrible.
Some of our
Stop it.
viewers-
Stop. That's...
Dude, seriously.
I'm getting rid of this one right now because it's exactly what I was trying to find. And now the mouse is freaking out.
When things are wrong, I'll be by your side. Even when you want to cry.
Woot. Woot.
Welcome to the Naked Apple.
Welcome. This is the last recording
Of the year.
of the year.
Celebrate. You don't have to listen to us until next year. Oh, you know that was funny.
Take that pun and shove it
Where would you like to shove it?
into next year.
I see what you did there.
What's fun about next year is it's 2021, which means that 2020 won.
It's okay.
Since we're here with terrible jokes.
All of the terrible
All
jokes.
of
All
the
of the terrible
terrible-
jokes.
Terrible jokes.
Oh, that's interesting. One of your links is no longer present.
The video?
No, Californians flee projected House seat electoral vote. That one. California down a representative. When I click the link, it goes 404 page not found.
Well, that is rude.
I know, right? You might have to go to the Wayback Machine for that one. It's almost as if they think that deleting the article will make it so that we can't read it. Plebeians.
Knaves.
Knaves. How dare you besmirch my honor? I am more intelligent than that. What, do you think just because you make it go
Alright.
away that I won't remember it was there?
I found it again. I just typed in California's fleeing, and there it is from Washington Examiner. There it is.
Interesting.
Whatever.
When I click the link, it says no.
Yes, but I typed in the search California to lose electoral seat, and
Tells
there it is.
me no.
Anyway,
That's
that's
neither here nor there.
well, it's there. Here is personal jihad that I have. Probably Mike has too.
We are going crusading.
Was stolt. I guess we should start with our daily dose of vitamin B, right?
I guess that's a thing.
It's only been a thing the last last handful of episodes.
I mean, I like it as a thing. I just gotta find the ones that I want to read.
People
this
expect
time.
it. They expect it.
Well, they should expect it because
Should expect
we
a
have
lot.
it. So,
Why? Oh my goodness! The
what did you break?
screen stopped recording.
Why did it stop recording? Why would you do that?
I don't know, but we're fine.
What?
We have audio, and then I can put our pretty little faces over the thing to make it
Just run the thing on.
run the thing.
You should start it again though, so that it can catch the videos.
But there was nothing
Right.
really to show other than just us talking.
But are there no videos tonight?
Oh no, there's it's starting. You
restarted.
Yes,
Okay.
yes, we're good.
Well, that's fine then.
All right,
Okay, everything's fine here.
it's fine.
Is the wall on
fine.
fire? Okay.
This is fine.
All right. Well, let's go to the vitamin B.
Vitamin B.
Welcome to the NABB News. Today's news
what you did there. I see it.
Hey, we have today in lifestyle. Man has a few days left to be a disgusting slob before completely turning life around on January
yes.
1st. Yes, get ready. That day is approaching fast. And also be sure to look up your fad diet so that you are ready to go, because looking at Friday, guys.
Friday.
Friday is the day when you gotta cut the weight.
It is
Sneak it. It's sneaking up on you.
just like your weight. It is sneaking up.
So, in other news, reported miracle. Government feeds 5 people with just 2.3 trillion loaves and fishes.
That is miraculous. Normally it's 4.
So miraculous.
Stretch that out.
4
to 5
people usually that they feed with that many. They've stretched it to 5
Yes.
this time.
I believe that's what I said.
Yes, exactly. That's what you said. Isn't it what we always say? In social media news, Twitter fact-checked God's claim that Adam and Eve would surely die if they ate of the forbidden fruit.
Good.
Their fact-checker, Satan, was adamant that what was reported was indeed false. In fact, he claimed, did God even say it? In other news...
I'm just asking questions.
I'm just asking questions. Donald Trump has been nominated for Babylon Bee's Christian of the Year. And for the 3rd year straight, he wins. So, there are many dedicated pastors and missionaries amongst Christians, but nobody has withstood the number of spiritual attacks that Donald Trump has.
Right.
The devil threw everything he could at him, from Russian hoax, Twitter censorship, Nancy Pelosi, and yet the man stands bravely,
the myth,
against
the
them all.
legend,
with his massive rallies and his life-saving vaccine that most of us won't take because it's probably the mark of the beast. We've had a fantastic year with a great man.
Good.
So the runners-up this year were Sidney Powell, Rudy Giuliani, Jerry Falwell Jr., Rick Warren, Beth Moore, The Mandalorian, Ben Shapiro, Joel Osteen's Inspiration Cube, and, of course, Elon Musk.
Of course.
And for the last little bit that we're going to leave with you, everyone in Congress gets a $100,000 bonus for coming up with such a great relief bill. They are patting themselves on the back so hard this year. It's a wonderful early Christmas present.
You know what? They deserve it.
They deserve it.
Because while we have been just stuck at home doing nothing, they have been slaving away trying to get us $600.
Trying so hard, and so they each deserve $100,000 for themselves.
Yes.
This has been your NABB News.
Beep, 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 beep. All right, now for satire.
Now for the satire.
You really would think this is satire with where we're going here. Because we're starting with St. Fauci.
Oh, yay. Our Lord and Savior Fauci.
So he did an interview with the New York Times.
Oh, did he?
He did.
Good for him.
He told the New York Times that he's been lying the whole time.
What?
Yeah. So we're pulling this from the Blaze because they summed up the New York Times.
He's been lying to me?
No. Yeah, New York Times. Fauci admits to deceiving the public about herd immunity because he wanted more people to get vaccinated. Oh. The Times article cataloged Dr. Fauci's changing position on how many Americans would need to be vaccinated, which he initially stated would be 60 to 70%. As noted by the Times, about a month ago, Fauci's tune began to change when he suggested that the figure was actually 70-75%. Last week, in an interview with CNBC, he upped that figure again to 75 to 80% plus. In the interview with the Times, he changed his estimate yet again to suggest that the figure actually may be close to 90%. And it gets better. According to the Times and telephone interview, Dr. Fauci acknowledged that he had slowly but deliberately been moving the goalposts. He is doing so, he said, partly based on new science and partly on his gut feeling that the country is finally ready to hear what he really thinks. You don't want to know what we really think. And then let's see. Ah, there. This one's my favorite right here. Right here.
Oh yes, this one. He adjusted his ideas based on polling.
When polls said only about half of all Americans would take the vaccine, I was saying herd immunity would take 70 to 75%.
Then, when newer surveys said 60% or more would take it, I thought, I can nudge this up a bit. So I went to 80 to 85.
But follow the science.
Yeah.
So-
And then he goes on to admit that he doesn't know really what the number is.
Yeah.
It's right here.
I'm not going to say 90%. Why won't you say 90%? Because doing so might discourage Americans. Because I'm not sure
And
that they'll voluntarily accept a vaccine to reach that goal.
And for those that are paying attention to all the stuff we've covered on this, was it 3 episodes ago? Oh, no, it was the Piss Off.
Yeah.
That's what it was. Whenever
Yeah.
those episodes were.
So like 3 episodes ago.
Those in there, you'll find an article where the CDC made an adjustment based off of quote unquote science that you don't have to quarantine for 2 weeks. You only have to quarantine for 1 week because they found that people would more likely stay inside for 1 week as opposed to 2 because science.
Huh. Really?
Piss off, Fauci. Piss off. He's only been lying since the beginning, but no, it's fine. It's fine. Luckily, though, we have Birx, Dr. Deborah Birx, to
Even
counter-
out
Yeah,
his
yeah.
his liarship.
You have one that's a little more conservative on their thinking of how to handle things, and one that's a little more progressive on how to handle things.
Wait, which one's which?
Although we're still trying to find that I'm dragging the wrong story because I have too many screens. Because that screen doesn't go to where I want it to go.
Inappropriate. Why do you have too many screens?
This screen goes here. So
I don't know why it's inappropriate, but
Some people don't even have screens.
that's inappropriate.
Dr. Birx has announced that she's going to retire because
She sucks at her job.
because people have been rude to her about her family trip to Thanksgiving. If you didn't know, we didn't cover it because she was echoing what everyone else was saying. But before Thanksgiving, she said, don't travel for Thanksgiving because you'll spread the Rona and people will die.
So then for Thanksgiving, she stayed home and didn't travel for Thanksgiving because people would die.
Except she did.
Wait, what?
Yeah, she...
Somebody in government was a hypocrite? What? This is my surprised face.
This is my surprise face. Here we go. She said she tried to sell it off. She said, I didn't travel because of family. I traveled because I had to, and family was just there. So yes, we got together for a dinner, but it wasn't specifically for that. But then she also said,
We didn't do this to celebrate a holiday. We did it because we were all in the same place at the same time, so we decided to do it.
and then she also threw this into her defense. I have to say, this experience has been a bit overwhelming. It's been very difficult on my family. I think what was done in the last week to my family, they didn't choose this for me. No, you chose this for them. This is you that chose this. They've tried to be supportive, but to drag my family into this when my daughter hasn't left that house in 10 months. My parents have been isolated for 10 months. They've become deeply depressed. Where have we heard people being depressed before? As I'm sure many elderly have, as they've not been able to see sons, their granddaughters. My parents haven't seen their surviving son for over a year, she added. These are all very difficult. There's tens of millions of other Americans that are exactly the same boat.
Insert snide comment about cure worse than the disease.
Yeah, so she's stepping down because she couldn't handle people pointing out that she's a hypocritical, elitist person of words that are rude.
Yeah. Yeah. So this is the part that gets me about it. It's whatever. She came out and made a statement about the holiday before the holiday, right?
Right.
And then she goes and breaks her own thing and goes and does a family thing. And you would think that then she would come back and be like, okay, you know what? Whatever, let's just move on. No. Instead, she came back, and the very first thing she did when she came back from the holidays was to berate people that ignored her advice before Thanksgiving.
Yes, she did that too.
Saying this. We know people may have made mistakes over the Thanksgiving time period. If you're young and you gathered, you need to be tested about 5 to 10 days later, but you need to assume that you're infected and not go near your grandparents and aunts and others without a mask.
You see, what she did there, what she did there was she assumed.
Y'all know what assuming does.
Mm-hmm. It made an ass out of her, and that's it.
And that's it.
Devil woman. That's the nicest thing I can say about her right now.
Oh, nicest thing I can say about her is she's retiring. And that makes me happy inside.
She's retiring on the government's dime.
That makes me angry inside.
There you go. I fixed it.
There you go. I fixed it. You douche canoe.
No, that's what her and everyone else we're talking about is. So let's see. Well, related to that, we got a few stories because she confirmed something that I've talked about now for 3 weeks. One of which, let's see, should we go to San Francisco? Let's go to San Francisco.
San Francisco.
Skip over Minnesota for now to go to San
SF
Francisco.
Gate.
Oh no! Questions about video from
What's making sounds?
That was me. San Francisco.
It was the Victoria's Secret ad in your little web page, wasn't
I
it?
don't want my wife to hear. In San Francisco, they're a little worried about overdose deaths right now.
Oh.
Not COVID deaths, overdose deaths, because there's more overdose deaths than there are COVID deaths in San Francisco. Huh.
By a lot.
By
triple.
at least 2. There's at least 2 more.
I mean, he's not wrong.
A record 621 people died of coronavirus. Died of drug overdoses in San Francisco so far this year. This was, so far this year, December 19th is when this was published. A staggering number that far outpaces the 173 deaths from COVID-19. Huh. Why you do? Why are you the way that you are?
Man, you gotta close that Victoria's Secret tab, I'm telling you.
But it's for a later segment. Yeah. So why are people overdosing is a great question to cover. Well, the crisis fueled by the powerful painkiller fentanyl could have been far worse if it wasn't for the nearly 3,000 times Narcan was used from January to the beginning of November to save someone from the brink of death. So people thought they were going to die from the Rona. Doctors thought they were going to die from the Rona, so they gave them Narcan. People got addicted to Narcan, and that's what they're reporting using to the Overdose Prevention Education Project in the city. Last year, 441 people died of drug overdoses, which was an increase from 2018. So yes, and they use Narcan to help people with those overdoses. So they've just been, we know you're addicted to all these painkillers, so we're going to give you a different painkiller.
Okay. There's something else interesting about this.
Uh-huh.
I want to point out.
Yes.
San Francisco, one of the more populous areas in California, right?
Right.
What would you say that the population there is roughly? Let's see. Let me look it up. 883,000.
All right.
People.
I was going to say a million.
So let me put it to you interesting enough here. I just looked up the number of deaths in California, Utah, a couple different places, right? So Utah, the entire state of Utah, has recorded 1,225 deaths.
For all things.
For all things, the entire state of Utah
For all the things.
has 1,225 deaths. Okay, so the population of Utah is roughly 3.2 million. So we're a little bit more than 3 times San Francisco County by itself.
Right.
Which would put us, if we were dying at the same rate there as we are here, put us roughly around 600 deaths. We're double what we should be if we were in line with them. But that's not the interesting thing. The interesting thing is that San Francisco County has only one other county in the entire state that is as low as it is. And that's Sonoma County,
Which has nobody living there.
which has 400,000 people living in it. So roughly half the size. It's almost 500,000. It's 494,000 people live there. So San Francisco County, as of today, has 182 deaths over the course of this year
From everything?
from COVID.
From the Rona.
Yes, from the Rona. 182 deaths. Sonoma County has 182 deaths. But San Francisco County has considerably more cases. So Sonoma's only 18,600. San Francisco's 22,595. And
They have the exact same number of deaths.
they have the exact same number of deaths.
Okay.
Yeah, the numbers are really weird in California. Like, really weird.
Well, part of that might have to do with what Minnesota is looking at.
Oh, what is Minnesota looking at?
Aside from recounting their ballots over and over again. Or they should be anyway. They're looking at, some lawmakers are calling for an audit of death certificates because the deaths could be inflated by 40%. The coronavirus deaths could be inflated by 40% after reviewing death certificates. And they come to this conclusion because they did a random sample of 1,000, I believe it was, 1,000 death certificates. They did a random sample of 1,000 death certificates, and 40% of them had coronavirus listed as the cause of death when it was not the cause of death. There were people that died in car accidents and fell down and other things that actually killed them, not the coronavirus.
Another fun little thing for you. on that. I just looked up the breakdown for Utah. So Davis County has about 1,000 more confirmed cases than San Francisco County does. It only has 82 deaths, so 100 less. 1,000 more cases, 100 less deaths.
And a much smaller county.
And a much, much smaller county. Interesting.
Curiouser
and curiouser.
Curious.
Not saying that means anything, but it's just interesting the way the numbers fall.
I apologize. It was 2,800. So they reviewed 2,800 death certificates and data points and found that about 800 of them did not have the virus as the underlying cause of death. Yet they were counted as coronavirus deaths. So they got some examples here. In Tennessee, for example, a hospital retracted a death certificate for a man who tested negative for the virus 3 times but was listed as a victim of the pandemic. In Colorado, a county coroner's office pushed back against the state's claim that another victim who tested positive for the virus died of it in Montezuma County despite dying of alcohol poisoning.
Oh, it's a good thing to know that this isn't going on all over the country.
It's a good thing it's not widespread. And from locally here, KUTV,
Channel 2 News, KUTV.
A ABC affiliate. Yes.
Yes, ABC to KUTV in Salt Lake.
They had a story. This was back in December 18th. Utah reported 14 more people killed by COVID-19. The coronavirus, I guess, is just going around just...
Wee, 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 wee.
It's a murderer.
It just killed them dead.
So, just to clarify something before we get too deep into this. Lying to someone is bad, correct?
Correct.
Intentionally telling them the wrong thing is lying.
Yes.
If you intentionally omit information that would allow someone to make a correct decision.
And intention is key. Yes.
Does that count as lying?
Yes.
Okay. We're on the same page. Okay. Sin of omission and the sin of
commission.
A good example of this would be don't touch that stove. Why? Don't touch the stove. Why? Just don't touch it. Yeah, but why can't I not touch it? Just don't touch it. Child touches the stove, burns their hand, yells at the parent. I told you not to touch it. You didn't tell me why I shouldn't touch the stove. Now my hand is mutilated. That is a sin of omission. The parent is responsible for that child doing that.
But the child didn't listen to the parent.
Yeah, the child didn't have all the information.
There is also that.
If the parent says, don't touch that stove, it's hot, it will burn your hand and you will be in pain and it will cause your hand to not be the same ever again.
Because it hurts.
And then the child chooses to do that. It's on the child, not the parent.
Yes.
The parent did it, their job. Anyway, keep that in mind. For Utah reported 14 more people killed by COVID-19 Friday, all over 45 years old, and from several counties around the state. Okay. All right. So that's a little synopsis, so there's probably more information later on that. Along with the deaths, there's numbers, blah, blah, blah. A full report of Utah's data is lower in the story. Is it? The daily data does not reflect people that have died since the previous. Man, that's terrible. Since the previous report, but have been confirmed to have been killed by the virus. So, anyways, they go through this article. They said there's the new deaths counted from all these counties. Only one was in the 85 and older age category. Oh, so they were old. All the rest who passed are between 45 and 84. Well, it's a big range.
So how many of them are between 60 and 84.
I'm sure they sum that up a little later. Let's see. United States and be more vigilant at Christmas, blah, blah, blah. California, la, 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 reported a lot because California sucks. This is something else that bugs me. All these stupid, I'm sure it's in other states too. Utah's got billboards all over the place. Paid for by Utah government, whoever. Mask, wear your mask. Snowman with a mask. Elves with masks. Santa with a mask. Maybe we should be spending money on actually educating people instead of fear-mongering people. I don't know. Maybe. Here we go. Stays. Yes. So, the epidemiologist for the state tried to reassure people that people that die of other things are not counted as a COVID death, because this is on the heels of Colorado's coroner saying, hey, these 2 people that are in my office, you have listed as COVID as cause of death. Clearly, this guy was in a car accident.
This man drowned. Yes, he did die of COVID.
What?
That's what I said. Sorry, Batman.
But they say cause of death is a narrative. This is on the Utah's coronavirus website. Cause of death is a narrative field on the death certificate. A certifier lists in sequence any health conditions a descendant had, so a health history, and the cause of death. They may also list any suspect COVID-19 symptoms, which would then be reviewed and investigated further by Vital Records or the Office of Medical Examiner. And then it's reviewed, and then it's reviewed, and it's reviewed, and it's reviewed, blah, 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 blah.
Investigation.
Yeah. All to make sure that it's not a false COVID death. That's fine. Okay, cool. But
then it's sent to the CDC where the ID10T codes are applied.
Yes. Sure. But then she says this right here. Or the website, I guess, says, if the test result is positive, but the cause of death was a car crash, they would not be counted in the COVID-19 deaths. Cool. It would be listed as motor vehicle crash on the death certificate. They would, however, be counted in our positive COVID-19 case counts. So, person smashes car, person dies in car. Dead body gets swabbed for COVID. Swab test positive for COVID. Person still dead is a new
Case.
coronavirus case. Yeah. Great grandpa dies in nursing home because he's old. Great grandpa then gets swabbed for COVID. Test positive for COVID. Great grandpa is still dead. He is a new coronavirus case. Yay!
I hate everything about this.
I hate everything about this. So then they break down some stuff for you here. The rolling 7-day average positive tests is blah blah blah. Here's more tests and more tests and more tests. Why are they focusing on the tests? I thought hospitals were filling up. Why aren't you telling us about the hospitals filling up?
Because they're not filling up. Because the people are testing positive, but they're going home.
Yeah, somewhere in here they said somewhere in this article they said something about Utah's hospitals are not as full now. So, well, how not as full are they? How full were they? How not as full are they now?
Well, we're down to like 60% now, so...
Yeah, we know because we know where to find the information.
We know because we go looking for
They won't tell you the information. Then they go down here. So here's all the deaths. They broke down the deaths. So now you know how old they are. 65 to 84, 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 45 to 64, 85, or older than 85, sorry. 65 to 84, 45 to 64, 65 to 84, 65 to 84, 45 to 64, older than 85, and 45 to 64. They could have been 64 years old, or they could have been 45 years old. But you just need to know if you're in that range, you're probably dead. And then they give you week by week cases by the week. Because the death count isn't scaring people anymore, and trying to tell them that the hospitals are full isn't scaring people anymore. So let's go back to the cases, because that's a bigger number. That probably scares people more. That's my running theory anyway. And in case you're interested, you can go to the one of the links from Piss Off episodes has links to various spreadsheets, one of which is hospital by hospital across the entire country since July, where you can see how full the hospitals are. In Utah, for example, the worst one that I found just looking at it quick was IHC in Murray, which is the biggest hospital, I believe, in Utah. Second biggest. But it's
I'm not sure if it or U of U is bigger.
The two are the biggest. How about that? Yeah. They're the benchmark.
U of U is just a couple down there.
Yeah, it's right. That I can even do.
Why don't you highlight that one too? Let's look at them all together.
That. So, for those that don't live or have not lived or been in Utah, Salt Lake County, almost right smack in the middle, is IHC Murray. Intermountain Hospital Centers, whatever. And then just 4 miles away up the road is St. Mark's Hospital. So geographically, they're not really all that far apart, and they're both dead center in the middle of Salt Lake County. So they should have, at least statistically, the same stuff. St. Mark's is smaller, so they won't have the same numbers, but they should have statistically the same amount. And then the U is a teaching hospital, and it's huge, and it's big, and it's at the corner of the valley, and they take a lot of homeless people in. Just because that's their location. But as you go through here, you'll find these reports are gathered week by week, and so it's a 7-day average on all of these. But you'll have the total number of beds in each hospital, adult hospital beds available, and
these are 7-day averages. Because that number fluctuates,
right? Because you got beds just wheeling stuff in and out of this place. You never know which IHC is the worst offender with keeping track of how many people are actually there, or beds, I should say. But anyways, let's see. Inpatient beds used out of all beds. So IHC is the middle one, 459 available. And 357, we'll say, are being used. Well, that's pretty full. That's like 70%, right?
Yeah. That's on average. Some days are higher, some days are lower. Because, as people get better, they tend to leave the hospital.
But then there's inpatient beds occupied, which is less. 322. So I wonder if they're doubling up on some people, or I don't know. Anyways, so 322 out of 459, still pretty high. But then
I wonder if Scott would know what most of these numbers are. Referring to.
Technically the website defines what all of it actually is. But anyways, total adult patients hospitalized, confirmed and suspected COVID, 71 out of 322. Or out of 459. Because that's
the total number of beds. The total number used is 356.
Right. So their occupancy, they are able to have 459. And 71 of those are occupied by COVID, which is amount. And the U, for example, is 731, and they have 68. So
I mean, that's like almost 10%.
so full. And then you have St. Mark's at 269 and 25.
That one's almost 10% too.
Yeah.
Actually, Murray has the highest percentage there because 71 is almost 20%.
Right. It's almost double a hospital that's up the road, statistically. Not
The ones I find interesting are the ones that are negative 999,999.
Yeah, that's because of some information thing. I don't know.
Information error.
Yeah. But
Divide by 0.
well, the real issue is the ICU. The ICU is the main thing. Here's a fun one. So where I'm at right now, this is the pediatric side of things. Zeros. There are 0 kids. Well, there's 14.3. That's the primary children's. So there's 14 confirmed and suspected, but then there's 0 confirmed. So no children are at the hospital with COVID. Yet our schools can't be open. Nope, can't open those schools. So the ICU, which is the real, that's the actual important thing to look at. So ICU, there we go. 56 are available at St. Mark's, and they're using 32, but only 6 have COVID. 6 in the heart of Salt Lake. IHC has 144, but 28 have COVID, and statistically that is a lot higher than St. Mark's, which is, again, just up the road. And the U has 32 people with COVID. And they have 176 beds that they can use for COVID in the ICU. Yeah, if you go back, you can find your state, go through, and get mad at whatever hospital is in your area. And then you can contact people who are supposed to be.
Yeah. And that's 3 of the, 5 hospitals that actually are COVID centers in Utah?
St. Mark's,
Out of
St.
the
Mark's is
53?
not a COVID center.
Oh, St. Mark's is not a COVID center.
Which is why they weren't receiving the vaccine when it first came to Utah.
They
were.
They have COVID patients. How are they not COVID center if they have COVID patients? Is that
They have to save some of the vaccines for push the right button. They have to save some of the vaccines for politicians and other leaders to be able to put on a show.
excuses?
And speaking of shows, where'd you go? I missed you so.
Seems like it's been forever since you've been gone. I can't carry a tune in a bucket. That was terrible.
Some of our
Stop it.
viewers-
Stop. That's...
Dude, seriously.
I'm getting rid of this one right now because it's exactly what I was trying to find. And now the mouse is freaking out. It doesn't know. There we go.
Oh.
So,
Wow, that's the worst Victoria's Secret model I've ever seen.
So this one, for you, Mike, you have to click on the link they have in the description because they got rid of the video. So you have to go to the original source to find the video.
Wait,
Anyways,
where'd that go? Which one is this?
it's the Metro one.
Metro.
Yeah. So this was in University of something or other, El Paso, Texas. There we go. It was a hospital there where, people were doing the vaccine stuff. They were showing, hey, it's great, it's fine.
Questions about video we showed from
See if you
Tuesday's
notice
UMC
what
event,
happens.
specifically the second vaccine that was administered, and we do have some close-up video you'll only see on 9 this morning. Apologies to those who are squeamish when it comes to needles. You can see the UMC healthcare worker with his sleeve rolled
prepped
up,
to have his
but when it
shot
comes
taken.
time for the injection,
I
look
can
at the
see
top of
the plunger
syringe. It
already
appears
depressed.
the person
Plunger is
administering
down.
the
He-
shot does
he
not
realizes it's
really
down,
push
tries to pull it
down
up,
on the
can't pull it
plunger.
down, so he's
actually
just,
looks like
okay,
the
we're
plunger's
done.
already depressed. Our viewers wondering whether the worker received the vaccine at all. Now, for comparison, let's take a look at one of the other injections administered just moments later.
This one is also kind
to
of
a
curious.
woman. You can see
pushes
this,
it
the
in,
plunger
he pulls
is
it out, and
clearly
pushes it
pushed
down.
down all the way. And when we show them to you side by side, you might notice the difference. KTSM reached out to UMC for a comment. The spokesperson maintains all 5 healthcare workers were given full doses of the
Were
vaccine,
they?
But the hospital is taking a closer look at our video.
It's okay, everyone. Take the vaccine because we'll just shove a needle in there and it's not actually there. But you got it. You got it. Yeah, the hospital says they've reviewed it and they've made sure that that person actually got the vaccine in a statement later. But
It's actually really interesting if you research the vaccines and the different types of vaccines there are. Just a rabbit hole off of all that, yeah. Because the vaccines that they're doing now are actually a fairly new concept for vaccines.
it is. And
Because it's the mRNA vaccines, which are different than normal vaccines. Because normal vaccines are
you take the dead virus.
take the dead virus or a piece of the dead virus or the toxins from the dead virus
or
and
an almost dead virus.
yeah, things like that, and you put it in essentially a saline solution, suspend it and whatever, and then inject it.
Right.
So the mRNA viruses or vaccines are completely different. It doesn't have the virus in it.
Right.
It's basically just an immune booster.
It's almost like a zinc shot.
Almost.
But since we're on this rabbit hole, pow! Moderna actually had the formula for the vaccine for a little bit. And by a little bit, I mean January 13th. Yeah. So here's a little timeline. This is from, I have no idea, New York Magazine. You may be surprised to learn that of the trio of long-awaited coronavirus vaccines, the most promising, Moderna's mRNA 1273, which reported a 94.5% efficacy rate. I think they since changed that to 95. But anyway, on November 16th,
Those are rookie numbers. Gotta bump those numbers up.
had been designed by January 13th. And in case you forgot, this was just 2 days after the genetic sequence had been made public in an act of scientific and humanitarian generosity that resulted in China's Yong Zhangjiang's being temporarily forced out of his lab. So the doctor that tried to warn everyone, I believe, that ish is going on in China and then disappeared. He, I guess, got this sequence out for places to use. In Massachusetts, the Moderna vaccine design took all of 1 weekend. It was completed before China had even acknowledged that the disease could be transmitted from human to human, more than a week before the first confirmed coronavirus case in the United States. And by the time the first American death was announced a month later, the vaccine had already been manufactured and shipped to the National Institute of Health for the beginning of its phase 1 clinical trial. And if you go to our Liars episode, you will see us talking about Donald Trump saying that he is working with companies that already have things in phase 1 trials. And he was lambasted and shamed for it, for it's going to take 7 years to get a vaccine.
It took all of a weekend.
Took 1 weekend. Now, granted, they still had to do their testing and blah, 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 and then coincidentally wait a few days after the election is over to announce that they had a vaccine to the Joe Biden's team before they announced it to Donald Trump's team. But I digress. Yeah. Yeah. So that's really all that was interesting in this article. The rest of it is just medical.
And space references to
Yeah.
vaccines.
Yeah. Yeah.
Be like landing a man on the moon and then saying, hey, we should go to Mars. Isn't that pretty much exactly what we did?
Exactly what we did. We reached the goal. There was no more goal to be reached. So we set a new goal. Huh. That's kind of how goals work. Whatever. Let's see. NBC.
Yeah. The NBC doctor?
The NBC doctor.
Ooh. NBC doctor.
So the vaccine's going to help us all, except, once everyone gets the vaccine, we'll finally be able to get back to normal life, right? Right?
Maybe not. No,
well,
definitely not.
According to this guy that was on NBC, people shouldn't travel or be liberated from wearing masks until next summer, even if they've been vaccinated.
I love how he used the word liberated.
Yeah. So you admit this is tyranny. He appeared on screen as expert on NBC News, facing harsh blowback after he suggested on air that even people who have been vaccinated for the novel coronavirus should not travel until the vaccine has been made available to the entire country, which will not happen until next summer. You taking notes from Fauci or something, or
something?
Dr. Vin Gupta, MD. Just because you get vaccinated after the second dose does not mean you should be traveling. You could still get infected and pass it along to others. Then what is... If you receive a vaccine, that means you're vaccinated, right?
You would think. Usually.
Right.
Usually you get the flu vaccine so that you're vaccinated and then you don't have to worry as much about the flu.
Getting the flu.
Yeah, you still usually can get the flu, but your body's better equipped to fight it.
Right. So the flu is
kind of how vaccines work.
If you don't catch the flu, it's at least not as bad if you get...
yes, you can still catch it.
Yes. If you catch the flu, it'll not be as bad because your body is already prepared in some degree to fight the flu. So I guess everyone's getting those empty flu shots from El Paso.
I got one of those.
An empty flu shot?
Yes.
Yeah.
I got one of the ones that didn't have the needle on the end.
Plunger was already depressed and there was no needle.
There was no needle. I vicariously
What are you doing, Doc?
absorbed it. It was great. Good to go. Golden.
He said, just for your viewers out there, I know one of the officials who we just saw getting vaccinated is planning on traveling after the second dose.
It's probably the one that had the plunger depressed.
This is a source of confusion. You don't say. This is one of the perceptions out there. Just because you get vaccinated with that second dose does not mean you should be participating in things like traveling in the middle of an out-of-control pandemic or that you're liberated from wearing masks. If the pandemic was so out of control, wouldn't healthcare people be dropping like flies?
You would think, considering they're all exposed to it all the time.
Well, they have the PPP. They have things.
Except for, haven't you been reporting for months that they don't have enough PPP?
Oh. Everything still applies until all of us get the 2-dose regimen. He's going for 100%. Until all of us get the 2-dose regimen. And we don't think that's going to happen until June or July. And again, this goes back to what we just talked about, Chuck. We don't know if just getting the vaccination prevents serious illness, or does it also prevent you from getting infection entirely? Meaning you can still get infected with the virus potentially and pass it on to others. So really, really critical. Don't let your guard down just because you got vaccinated. You still blah, blah, blah. I hate him. I don't know him, and I hate him. And he needs to talk to the CDC because when I got my phone call from the health department of Utah,
I do not care for him.
After I tested positive for the Rona, and I got my all clear phone call after I was already all clear. They told me that for at least 90 days, I cannot contract nor give the virus to others. And if you dig into CDC stuff, you'll find they say 90 days to 10 years that you are immune to the disease if you contract it.
But there's been so many people that have had it twice.
Three people.
3? Is that including the one sports guy that caught it twice? What was his name? I don't know. I don't follow sports.
I don't know.
I wonder if I'll pull it up if I type in sports guy that contracted coronavirus.
Do it.
See how good you are, Google. See how good you are.
Read my mind. In the meantime, something that this doctor might want to read, because I'm sure he subscribes to the Journal of American Medical Association's monthly magazine. Because in that journal, I need to fix this. In that journal, they published a study. So it's a published official study. The risk of catching coronavirus from a family member you live with is just 17%, and only 1 in 3 people pass it on to their spouse. Researchers analyzed 54 studies with more than 77,000 participants reporting household secondary transmission of coronavirus. Overall, 16.6% of those infected with COVID-19 passed on the disease to members of their household. The secondary attack rate was 18% among people who had symptoms of the virus, but just 0.7% among asymptomatic patients. So if you have symptoms and you're in a house, which we are told is the worst air you can breathe because it doesn't circulate very well and people honestly aren't that good at sanitizing everything. There's only an 18% chance that you will spread it to someone else. If you are symptomatic. If you have 0 symptoms, there's a 0.7% chance that you will spread it to someone else. It's almost as if it's like every other virus that we've had to deal with. More than 1/3, or 37.8% of coronavirus patients infected their spouses with the illness. So the person you lie with face to face and kiss and whatever else you do with your spouse, 1/3 chance of spreading to that person that you are macking out with. That's what we're afraid of. So widespread.
So deadly.
And related to that, I believe it was in New York, a study found that just over 1% of cases spread were the result of restaurants.
Oh.
Yeah. So shut down the restaurants so you have to stay home, where you will absolutely contract the disease in comparison to the restaurant.
Well, you know, if the disease is there.
In comparison to the restaurant.
Yes. But, yeah. No, I don't have any.
I got nothing. Did Google work?
No, Google failed me.
Google
it
failed.
did, however, tell me a very interesting story about a 25-year-old man that caught it twice.
Oh, good for him.
Uh-huh.
Did he actually catch it twice, or did they find a dead virus when they were swabbing his nose and then find another virus?
He caught it, got over it, and then caught it again, and that they said that the second strain was genetically different than the first strain, which to me implies that it was a different strain of the virus that he caught the second time, which would mean that we've had more than one strain here since April.
At least.
At least.
Yeah, because we know the original strain.
The second time he caught it was much worse than the first.
Was it?
That's what he says. The first was very mild. He was over it in a few days. And then the second time, he was down for a couple of weeks with fever and things that he didn't have the first time.
Oh.
Like actually being sick.
Like actually being sick.
No, like literally, they describe his symptoms the first time and it's like nothing. Like he didn't have hardly any. And then the second time he had a fever and all kinds of stuff.
Bleh.
Anyway, what are we on now? Daily Mail?
Let's see. We are on.
Is that what we just talked about? That's what we just talked about.
We're going to kind of just blast through these. We've been going almost an hour now.
Yep.
So, a study has found that, shockingly, the sun can kill the virus. By sun, I mean UV lights that the sun emits. Surprisingly, a team of scientists from Tel Aviv were paid to see if the sun, the UV rays, can sterilize viruses like it has every other virus and like they said it does at the beginning of this stupid thing. And their results said yes, indeed it does. The big takeaway is they made these little LED, UV, whatever things you can swipe across a room or whatever, and it sterilizes everything.
It's a sales pitch. I know a sales pitch when I see one. I see a sales pitch.
It's probably tied to a pyramid scheme at this point.
Probably is.
And then, coronavirus is racist. Because we have from July. We have from July how COVID-19 has disproportionately affected minority communities in every state. So minorities have contracted it more than white people, and their minority economies are hurt more than white people economies, blah, blah, blah. This was back in July.
Is it because the white people don't listen to the Democrats? Is that...
Shots fired.
I'm sorry, I couldn't help
Shots fired.
it. It's just not a reflection on the black people. It's a reflection on the Democrats.
And now we have from Time Magazine here, fueled by a history of mistreatment, black Americans distrust the new COVID-19 vaccines. But it's hurting you more. Yeah, but I don't trust them. But it's hurting you more. But
as you
don't
shouldn't
trust them.
Don't trust anything your government says.
I
It's
think
a terrible
somewhere
idea.
in here it shows a study that majority of blacks and don't trust it, blah, blah, blah. But, you know, it's so racist and so bad that an expert has told the New York Times elderly white people shouldn't get the coronavirus vaccine priority in order to level the playing field with minorities. But the minorities don't want it. So let's give it to politicians instead.
I think that's a grand idea.
Yeah. I don't know how this isn't racist.
I don't either. It's so racist.
Elderly people shouldn't get it first because they're mostly white. Huh?
It just says elderly white people shouldn't get coronavirus vaccines. It doesn't say that they should.
Like that. Reading through his stuff, it kind of implies that.
The issue of ethics is very significant, very important for this country, and clearly favors the essential worker group because of the high proportion of minority, low-income, and low-education workers among essential workers. So what I hear from that is that if you have a job, it's probably because you don't make money and you aren't very smart.
So there.
It's reasonable to put essential workers ahead of older adults, given their risks and their disproportionality of minorities.
Disproportionality.
Older populations are white. Society is structured in a way that enables them to live longer. Really? I mean, both my parents were white and they died in their 50s, so... That was before they were even in their, in the danger zone for COVID. They were
They did not go to the danger zone.
They didn't make it. They did not fly into the danger zone. Not at all.
Also, so straws have been killing turtles, right?
Well, if the turtles were smart enough not to stick the straws up their noses.
If turtles weren't so stupid.
That's right.
So now the turtles have to worry about 1.5 billion mass in the ocean. Congratulations, world. We flattened that curve hard.
You talking about the 15 weeks to flatten the economy?
15 days.
Oh, 15 days to flatten the economy?
Yeah, that we're almost at
The curve. Sorry.
Yeah.
My bad.
I misspoke again.
I misspoke again.
For months, we've seen face masks in places they shouldn't be. Storm-drained streets, beaches, and parks. Yeah, because you're making people wear them. Now we're learning just how many could be flooding our oceans. Once plastic enters the marine environment, it's difficult to move. About 6 weeks after COVID hit Hong Kong, so late February, we began finding masks, and lots of masks. What's remarkable is we weren't finding masks before COVID.
Almost as if people weren't wearing them before you forced them to.
The fact that we are starting to find masks that are breaking up indicates that this is a real problem, that microplastics are being produced by mass. Oh no. The question that we couldn't answer was how many are entering our oceans. We just didn't know. And so then they did some stuff. 52 billion masks manufactured globally. It's believed 1.56 will enter our oceans this year, resulting in additional 4,680 to 6,240 metric British tons of marine plastic pollution.
Metric British tons? So is that like,
TONNES.
what, 3/4 of an American ton?
Yes,
Oh, okay. Just checking.
because we're better.
I still want to go back to the fact that what's remarkable is we weren't finding face masks before COVID.
Yeah.
Did you really say that out loud?
And these people get paid a lot of money to make these scientific conclusions.
Thank you, Captain Obvious.
Yeah.
What is wrong with you?
The report notes global sales of face masks surged from around 800 million in 2019 to 166 billion in 2020. Yeah.
There is a spot on my face where my smile once was. Somebody's making money.
That's important. We need to keep people safe. But at the same time, that has a lasting impact on our environment. And we're seeing that on the beaches. Those California beaches that nobody can visit because we won't let them visit the beaches.
This is hilarious. So the report is it lists these ideas of how to fix the problem. So it's all like like implement policies designed to encourage the use of reusable masks, such as releasing guidelines regarding the proper manufacture and use of reusable masks, foster innovation in the development of sustainable alternatives to single-use plastic masks, discourage littering by increasing fines, and educate the public about responsible ways to dispose of masks, repair and improve waste management systems to reduce losses and spillage. Each one of those things has a multi-million-dollar price tag on it. I have something. I have an idea. It's a brilliant idea. It'll cost us nothing. It'll solve the problem.
Hold on. Is it related at all to going to the top of this article?
What is that?
This.
Almost.
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 Okay,
So
almost.
So here's this idea. I have this brilliant idea. So we call on the government, like they're planning on calling on the government to implement one of these four things that'll cost money.
So far, it's
So
on
this
par
is
with their
this is
stuff.
great. I'm on par. So we're calling on the government
Yes.
to step down and let people stop wearing masks.
So you want to implement a policy to
Yes, a policy to say that people can do what they want.
to tell people that you are now free to move about the country.
Yes. Yes. It's very simple, very not pricey, and very much longer term than making a policy for something that's not going to last forever.
Well,
I think it's brilliant.
if you want to do their policies, you're going to need a way to pay for it, right?
Right. I have a brilliant way to pay for my policy.
Uh-huh.
Yes, cut taxes.
Huh.
Let
Slash
people
it.
go.
Slash
yes.
it. Slash
cut
it.
cut taxes. Let people go back to work.
So if I was in their think tank, here's an idea I would throw at them. If I was,
I just got thrown out of a window in a corporate building.
right. But if I was thinking like them and I thought we need these policies and naturally we need a way to pay for these policies, let's do this. Should you pay higher taxes because you work from home?
Well, I mean, if you're in California, you can pay higher taxes for living in a different state.
This
So-
is coming from Deutsche Bank, which
Deutsch.
Deutsche
It's the Deutsch.
Bank.
The douche canoe bank. Deutsch.
Deutsch. But they propose a tax on remote workers because, there's this sudden decline in revenue because there's not all this business revenue coming in.
You
so-
need to have a convenience fee for being able to
Right.
work from home.
Right.
So, great idea. Yes,
By the way,
convenience fee.
You have to work from home if you can.
You were required to stay home
And now
work.
since you have been voluntold to work from home, you have to pay 5% because you get to work from home. That's a good plan. That's almost as good as the guy on Joe Biden's coronavirus team that wants to pay you with your savings to stay home.
This article cuts me deep,
Yeah.
Right.
Yeah, there's been a lot of cutting.
right down to the founding fathers' bone.
This is they are
Bones, they're rolling in their grave.
they are spinning like lathes in their
We could probably naturally power the country off of
all
off
part
of the
plan.
rotation right now.
Yeah, so it's all
Or nuclear energy, because that's much more efficient than anything else that they are throwing out there for their
yeah,
green
but you
New
have
Deal.
no evidence of that.
Yeah, you want to go there?
You don't have standing.
I'll take this to court.
I'll take this to court. Yes, that's the jihad. That's the COVID jihad. Continuing on. I think
I'm so glad I read one of those articles before we started this. I skimmed the other 17.
I've been holding on to these for going on 3 weeks now because some of them happened right after the piss off episode.
I mean,
One thing I didn't get to was Nancy Pelosi, the whole COVID relief bill stuff. Nancy Pelosi was angry that Republicans wanted to give people more money. And then she blamed religious people for why COVID vaccine isn't doing so well. And then she said Democrats are amazing for pushing for more money because Donald Trump finally gave in for more money, even though Donald Trump back in October said you need more than $600. But,
this is a terrible thing for us to get into. It's a terrible, terrible thing.
which is why we're going to end it here and probably just record a second one.
I could
still have
I
stuff.
could talk about that for a minute, because the bills and everything involved there.
Hot minute.
Yeah, it is warm.
You want to just slice it there?
Just slice it there. We'll do two-parter
Yeah,
again.
another two-parter. Yay!
All right. Well, we'll speak to you soon.
Bye.
Bye. Now we're recording.
Oh, now you're recording.
Yes,
and
now
now
I'm
I can
recording.
now I can hit the record.
Hit the record button. Do the record
Wait
thing.
for it. There it goes.
I'm waiting.
It has begun.
It has begun. That man has a monocle. Okay, let's go.
Monocle.